Hi, good evening, everyone. Dr. Elizabeth Rostan here, and it's just now 6 o'clock, and we're starting our September webinar about sun damage and laser treatments for sun damage since it's the end of summer. So we'll go ahead and get started. We're going to start by talking about the sun and how it affects your skin. And we'll talk more about lasers and how they remove and correct sun damage, and how here at Charlotte Skin and Laser, we utilize these lasers to help you achieve better looking skin. Talk a little bit about preparing for procedure, and then we'll finish up with talking about some of the products that help you along your journey and help you get best results you can. So when we talk about aging, that's what this is all about. There's really two types of aging: intrinsic versus extrinsic. So intrinsic is the loss of collagen and elastin in our skin as we age. After the age of about 30, you're not producing new collagen. And I talk about it being like an hourglass, and your collagen is the sand going through the hourglass, but there's nothing going back in. Extrinsic aging is the effect mainly of the sun. Pollution can also affect it, and radiation, but it's mostly sun that accelerates the loss of collagen and leads to changes in the skin that we all view as sun damage. We'll talk about those just a little bit. So really what is responsible for up to 90% of the visible skin changes is from sun. UVB causes burning and skin cancer, and UVA causes tanning, but also a lot of aging and breakdown of collagen. And this is a little diagram showing that the UVA penetrates a little bit deeper, and UVB is a little more superficial. UVC, our ozone layer, protects us from UVC. So the ultraviolet radiation is predominantly UVA and UVB. When you get your sunscreens, you look at it and you want to look for UVA coverage as well as UVB. These are our two types of skin. Sun. That causes sun damage, tanning, as well as skin cancer. We're not going to get into skin cancer. We'll save that for another time. We're talking today about how these ultraviolet radiation rays affect the skin in a way that accelerates aging, and then we'll talk about how we can help correct that. And some of you may have seen a photo like this before. This is an ultraviolet photo that really highlights sun damage on the skin. So her little photo on the left, she doesn't look like she has a lot of sun damage, but then when you highlight it with the light, you really see below the skin surface and a lot of sun damage, a lot of freckling and changes. If you come into Charlotte Skin and Laser, we've got a little light you can look at yourself. So how do you know if your skin's been sun damaged? There's some questions you can ask. Do you get freckles when you go out in the sun, or do you have freckles? Do you find they lighten up in the winter months? Really, have you ever been sunburned? If you've been sunburned, you have had some sun damage. And how often did you sunbathe before the age of 18? I know I did. Well into my 20s, and I'm paying for it now. Do you spend a lot of time outdoors? People are surprised. I often ask them, well, what do you do outside? And they look at me like I'm crazy, but I like to get to know how you're spending your time outdoors and see how we can best manage that for you. Tanning bed. Tanning beds emit 12 times more of the UVA than the sun. So if you've been in the tanning bed or continue to go in the tanning bed, not only are you increasing your risk of skin cancer big time, you're also increasing the sun damage to your skin. Using tanning beds before the age of 35 can increase your risk of developing melanoma significantly. That's another thing when you're getting your skin check, we'll often ask about tanning bed. So understanding your current sun damage, mild to moderate sun damage, these are usually the first signs. Some mild freckling, like this over here, some texture change, some fine lines and wrinkles, just some changes. You're not looking quite as youthful as you used to. But then when you have more moderate and severe sun damage, you get a lot of freckling, as you see on the photo on the right, and deep lines and wrinkles down here, particularly in the perioral area, but also on the cheeks. And some of this is called elastosis, which is a collection of damaged collagen and elastin in the skin, giving it kind of this textured look, and certainly gives it some of the deeper lines and wrinkles. So I talk about this a lot, about how the sun damages your skin. So collagen and elastin make up the structure of our skin. And we lose that as we age, but the sun greatly exceeds that. The sun will activate an enzyme called matrix metalloproteinase, big name, but basically this is an enzyme that destroys our collagen. So collagen is damaged when you go in the sun. There's a little repair process, but each time it's repaired, it's less than perfect. And over time, you get these little dermal scars that are manifest as wrinkles, such as this little diagram over here. So loss of collagen and elastin, and then leading to fine lines and wrinkles. I talk a lot about tretinoin and retinol. Retinol blocks the activation of this enzyme. So that's why I recommend, as part of an anti-aging plan, the use of retinol to act against this enzyme that breaks up collagen. So the second part of the evening, we're going to spend time talking about laser treatment and how we use it to treat some of these signs of sun damage. We use it for hyperpigmentation or sunspots, texture change and fine lines and wrinkles, and can also help with redness. We have non-invasive as well as invasive ways of doing it, and to repair and regenerate some of the cells of sun-damaged skin. To help you achieve a more youthful look and a look that looks a little bit better without makeup, and smoother skin texture, and reducing some of those things that show up with sun damage. Kind of looking better, looking like you have makeup on when you're not having makeup. So why select Charlotte Skin and Laser for your treatments? At Charlotte Skin and Laser, we'll carefully evaluate your skin and discuss your goals to customize rejuvenation plan for you. We aim to kind of figure out what your #1 priority is and match what we have to that priority, and then share with you our expertise as well. We have a variety of laser light energy devices that selectively target different aspects of aging and sun-damaged skin. Some penetrate deep and stimulate collagen, and some target red and brown. We kind of put them all together in a customized plan for you. And we have exceptionally trained and qualified staff here, and all the treatment plans I review, but I kind of keep track of your progress as you go along, or I sculpt a plan for you myself. So what goes into that evaluation? Well, we look at your skin type, and with lighter skin types, there's a lot more options. I will frequently say to someone, just said something today, she was very fair skin and she was nervous about the laser. And I said, really, with your skin type, all of these lasers are exceptionally safe for you. We can do almost anything that we want to your skin, and you'll do great. As your skin type gets darker, there's less options, and we choose our options a little more carefully because some of our lasers interact with the color of your skin, and we we have to be careful not to induce a change from the laser that we don't want to have, like hyperpigmentation. We try to figure out your goals and expectations and match what we're doing to those goals. I mean, that's like number one. We'd love to share our expertise with you, but it has to match your goals and expectations. We talk about budget and whether you want downtime or no downtime. We have a lot of people come from out of town, so they might want to get more done in one session, to kind of combine trips, and try to set priorities. And are there any events in your future you're trying to get ready for? Or is this just yearly maintenance? And then we look at what is there on the skin? How much texture and wrinkle changes are there? How much pigmentation? Is there redness we need to address? And frankly, a little check to make sure there's nothing worrisome there, and a little look for precancers. A lot of these treatments that we do also improve the health of your skin and reduce precancers, which is a bonus. So IPL is a great place to start. It's short for intense pulse light, and it addresses blotchy pigment, redness, broken blood vessels, fine lines and wrinkles, and texture. Just great for sun damage. It actually is not a laser. It is broadband light. So rather than one specific wavelength of light, there are numerous wavelengths, and some target red, some target browns, and it's kind of great for sun damage because there's often a lot of red and brown with sun damage. Great for skin types 1 and 2, sometimes 3. I don't really like it for darker skin types, and I think it can be dangerous. We choose other options. It's great for correction of sun damage or just maintenance. Like if you just want to refresh and look better, you've done some other treatments, you can do IPL. It's very popular and it's one of my favorites. It's been around for a long time. So it's really well studied. And we still use it because it's popular and it does a lot. One of the things we know about it, I'll move me, is patients who had a series of IPLs yearly for 10 years. They looked at them at the end of 10 years and showed a bunch of observers who looks younger, this picture or this picture, and almost all of the subjects picked the 10-year later photo as looking more youthful. So it really does a lot to stimulate renewal in your skin and rejuvenation. So we also can use our lasers to target pigment. And what we do is we look at the color of the freckle or the age spot, and look at the color of your skin. So the background color versus the age spot. And an ideal situation is very fair skin with really dark spot, because then we can really target that dark spot. As that gets closer to closer, either very light dark spot and kind of olive skin, it gets, our options for removing it get a little tougher. And we think more about how we're going to do that. Maybe we'll use a fractional laser if there's not a lot of differential in the color of your skin versus the brown spots. We also look at the number of spots. So if you have a lot of freckles all over, hard to distinguish background from just freckle, and maybe there's one that's bigger, it's really hard for us to remove that one bigger spot. It kind of tends to leave a little demarcation. So that factors into how we choose a laser for you. We would probably choose a full face treatment versus a one spot treatment. But sometimes I have people that really have pretty clean looking skin and great background, but just with 1 or 2 spots. In those patients, we can selectively target those brown spots. So really a lot goes into how we decide what device we're going to use and what's appropriate for you. Just to make sure that we choose the correct one for you. And we do choose from IPL. We also use the gentle laser, which is a 755. It's a hair removal laser, but we turn off the cooling so we can target the pigment at the surface. We use a Q switch laser, which is a 532 sometimes. And we can take any one of those, IPL, G-Laser, Q-switch laser, and pair it with a fractional laser to help remove it. And sometimes can even use an erbium laser. This should only be in the winter time to remove spots on the leg. And we'll go through each one individually. And we can target redness. So with redness, we also have the IPL because that targets red and brown. We also use the V-beam 595. For bigger vessels, we use a long pulse 1064. And then sometimes we'll use our new Venus Viva. It's a radio frequency device for rejuvenation, not a laser, radio frequency, but it seems to help with redness. So we have a lot of varieties for helping us reduce redness. And then we talk about renewing collagen. A big one to renew collagen is these fractional lasers. So we have the Ultralase MD, which is a 1927 wavelength. It's great for pigment, fine lines. It does not penetrate as deep as the Fraxel 1550, which is better suited for deeper lines and texture changes and acne scars. A little more painful because it penetrates deeper, a little more swelling. I would say that our 1927 is kind of our go-to. We'll go through this with some case examples of how we use the 1550 if we're really trying to get deeper lines and wrinkles. If there's a lot of sun damage, we need to go to what's called a fractional ablative. And this laser does have downtime because it creates little holes. So you will have a little bit of oozing from these holes. Sometimes we combine that with erbium on a focal area, and the erbium completely removes the upper layer of skin. And then there's fully ablative laser resurfacing, or the CO2, which we predominantly use in focal areas such as scarring or in the perioral or in the glabellar area. So all of these devices make impacts on the skin. And as these thousands of impacts heal, they help push out pigment, but they also stimulate renewal of collagen. In this video that we're watching up here, that's the laser going over the skin. It makes little beeps and clicks as it goes, and it's making all these impacts which help renew collagen and help us remove pigment. So at Charlotte Skin Laser, we like to have a winning approach to better skin by combining technologies. We've been doing this for years. And I think this is really where you can get the most out of the experts here at Charlotte Skin and Laser, because we just know how to put things together. Customized approach to targeting the different aspects of sun damage and aging, so you get the best results in as few treatments as possible. We also combine it with medical grade skincare to help you get the best results from your treatments. All right, so combining technologies. So in this patient, she's got a little bit of kind of brawny brown pigmentation, and there's some background redness. If I look closely at her, I see brown and I see red, and there's some little broken capillaries around the sides of her nose. And so if we were to come up with a plan for her, one suggestion is just good old-fashioned IPL. It's pretty simple and easy and targets red and brown. We can use the V-beam for the redness, or we can take these devices and combine them with the 1927 fractional laser. So V-beam plus the fractional, or IPL plus the fractional. We can do Gentilase as well for the pigment. The IPL and fractional, I think, would be a real winning approach here. This is more milder sun damage, some reds and mild browns. So again, you can do IPL. There's less red here and no broken capillaries. So we may not do just the V-beam. We may stick with IPL plus the 1927. Or if pigment is a predominant concern, we would treat first with the Gentilase to target the pigment, and then follow that with the Ultralase MD 1927. Or you can just do the 1927 alone We like to kind of combine things because, again, it's about delivering results in as few treatments as possible for you. It's less inconvenience, and there's a cost savings with that as well. And again, some fine lines are showing up as well as pigment, but because some fine lines are showing up kind of in this area, we may even think about that 1550. So the Fraxel 1550 penetrates a little bit deeper, and we get more collagen stimulation from that. So for her, I'd probably recommend a pre-treatment with the gentle lace for the brown spots, and then a combination fractional with the 1550 and the 1927 lasers. So we tend to call that the true dual or a true combo. In someone like this, you can also consider very light fractional ablative that gives a little bit of downtime. So lots of options. Another option is just if it's only the brown spots that are bothering her, she is fair enough with just isolated brown spots that we can take our gentle lace and treat those brown spots. They'll darken after treatment and then they heal. So lots of options here. But then you get an area where there's a lot of deeper changes, particularly around the upper lip and chin area. And again, this is a change that medically is called elastosis. It kind of looks yellow and bumpy. Sometimes people come to me and they want these bumps removed from their skin, but it's sun damage. When this is present, I know I have to use my more aggressive techniques, like a fractional ablative, or even a fractional ablative combined with radiofrequency microneedling. That combination really helps target all that sun damage, or a fractional ablative with erbium on the surface, and kind of just put it all together. We can also do a fully ablative CO2 laser. That's a good 2 weeks of downtime. And we can do that with or without the microneedling. So when we have that more severe sun damage, we need to use our more aggressive technologies. So let's look at some results. Yeah, the way. This is IPL before and after. A reduction in redness, a reduction in brown spots, and her skin just looks better, looks smoother and brighter and better. And another one here, a lot more redness. Now, a lot of times when there's this much redness, we can start with an IPL, and I think it was ideal for this patient because she's got a lot of brown on her cheek. And we just know we'll target that brown with the IPL and get a very nice result. But her mid cheek, right in here, she's very red, rosacea-like. I think she got an excellent result with IPL, but sometimes we have to use the V-beam pulse dye laser to really target that redness. So we'll often start with the IPL, see the patient back and follow up. For example, this for her, if we were going to do a second treatment, I think we'd continue with IPL. But if that cheek was still pretty red, we would probably do V-beam for the redness. So that flexibility with the technologies and choosing what's best for the patient, and helping you get the best goals, the best results you can as quickly as possible is kind of what we pride ourselves in and hope to achieve. This is melasma. This is not a #1 treatment for melasma, but we can use it and use the fractional treatment for that. This is a great result just with one treatment. This goes back to, again, what I keep reiterating about the combination. So she got a pre-treatment with the gentle lace Alexandrite 755 that targets the pigment. And so after that treatment, her little dark spots would look darker and almost a little ashy. And then we did the Fraxel treatment, and she got a true dual, the combination 1550 and 1927, because there's more textural changes, and got just a phenomenal result with one treatment. And I'll show you some treatments where we did more. Back in the old days, we used to do more treatments. and you just get better and better results. This is some more severe sun damage. We probably could do one of those treatments that has downtime, the fractional ablative, the Uzi one. But look what we can do with just one treatment of combining the pigment laser, the gentle laze, with the Fraxel 1927. She didn't even have the 1550, and there's probably a reason for that. It's maybe her choice and what she wanted to do or what her goals were. We're catching this after treatment 1, and so she probably had a second treatment, but this is just after 1 treatment. And a patient like this, you know, again, you got to be really conscientious about any spots that are changing or acting suspicious, and we'll look at them, and we're not going to laser anything that we're worried about. But doing a series of these treatments will make her skin healthier. It'll make it less prone to precancers because of the renewal process. This is not, we do it for cosmetics, but you get a lot of health benefit out of doing these laser treatments, and particularly when you combine it with a medical grade skincare plan. This is an older photo, but I put it in there because this just shows you what we used to do. We used to do 4 treatments spaced 2 to 4 weeks apart, and really just did a phenomenal result. This is the 1550, which penetrates deeper and targets the texture changes a little bit more. And here's an example of just kind of some diffuse redness. In this patient, we would target the redness probably with the B-beam, and that's what we did here. Again, redness is the predominant issue here. And so we chose our redness laser, very specific, to reduce the blood vessels and the redness. But look at her photo. You see how much smoother her skin looks, and brighter and prettier, and the light reflex looks better. Even just treating the redness, collagen is stimulated. We used to use the B-beam a lot just for like a V-beam facial, just to stimulate collagen and renewal. That was before the Fraxel lasers were developed. So great results from this. And in fact, there's rosacea, using it for the redness and broken capillaries. Here's an example of IPL with the 1550 after 2 treatments of the combination. Again, the IPL targeting the reds and the browns. And then for her, we chose the 1550 to get better textural improvement and improvement in the wrinkles and lines. Here's one where we, because there's a lot of redness, we treated her with B-beam with the Fraxel laser for skin rejuvenation. That's just after 1 treatment. So obviously, I just love this stuff because it's so fun to see patients back and see how well they're responding to these treatments. It's just very rewarding. And that kind of look that just looks better. Doesn't have to smear a whole lot of makeup on. And that's just with 1 treatment. And that's the 1550 for deeper lines. And this is from just IPL. So she's got appropriate skin type. She doesn't have very dark background skin. So if she's got some red and some individual freckles, and she just responded beautifully to IPL. And there's no downtime with this other than the brown spots looking darker and then peeling away. Sun damage can also cause broken capillaries and redness. It's very common. Here we used a combination of that long pulse 1064 for the bigger veins that you can see and almost trace out. So we treat that first, and then the background redness, that kind of flushing and muted redness, we went over that with the B-beam. So that combination gives us this kind of result with just 1 treatment. Now put this in, this isn't birthmark. We use these devices to treat birthmarks before and after. It looks great, but the reason I put it in is I was looking at this, and Oh no, this is the wrong slide, but her skin looks better. Putting laser energy in the skin stimulates renewal of the skin, collagen renewal. Even if we're just doing it for a birthmark, that heat and that energy in the skin made her skin just in general look better. Hopefully that transmits through these photos. But that's what we've learned about these lasers over time, is how good a job they do renewing skin. All right, so how to prepare for your procedure. This is where the fun begins. So this is me getting a treatment, and this will be on our YouTube. So I'm getting a pre-treatment now with the Genolaze on some freckles, and mine had to be treated twice. And I'm showing up in my grubby outfit. It's a sun protective shirt, which I do recommend, but I kind of have grubby hair because we put on topical numbing. And you don't want to show up with your best hair day because it might get in your hair, and we're going to put some saran wrap on and cleansers and then aftercare. So you come into our locker room and you can change into a gown, and then we're going to get started with doing a face wash and things like that. So not a glamour day, but we do have a full locker room. We did that pre-pandemic, back when people actually used to go back to work. But you can bring your makeup. We've got a vanity and a magnifying mirror, and you can get your makeup back on and go on with your day. You can even wash your hair if you don't like the idea of goop in your hair. We have a shower. This is the Genolaze that we do use for hair removal. And getting the Genolaze and a very thorough zapping there. The skin turns a little pink. If you had darker brown spots, mine were not very dark, so she's having to go over them more than once. You'll see them turn dark. And then the next step is the numbing. I don't think you can appreciate how goopy it is here. Oh, and the saran wrap. So the saran wrap helps the topical numbing get in the skin. There's the numbing, and you can go to our lovely relaxation room here and lounge. We have 2 lounge chairs, but we also have 2 nice chairs where you can take your computer and do some work. And then you wait like 45 minutes, 45 to 60 minutes. And you really do get very numb. This is the Fraxel laser, and you'll see it in action over here. And you can watch this video in total. There it is sped up. It's being run over my skin and is making thousands of impacts as it goes. The interesting thing to watch is you see my chin versus my cheek. It's red and a little swollen. So that's the immediate tissue reaction. You have some redness and some swelling. It feels tight from that swelling. You definitely feel heat. But I think the numbing cream works phenomenal. I don't love doing this without numbing. I'm holding my glasses in place because I really want her to get around the forehead and the eye area. And then we even treat my nose and everything. No stone unturned for this treatment. I think I had the rest of the day off. Now we're getting spring water to cool things off and some Elta laser gel. But I'm back at work the next day. And in fact, I would even forget that I had the treatment until I touched my face, because when you touch your face, you can feel all those impacts. They feel like a little bit of sandpaper, and they hang on. They look like little dots, and they hang on. For me, they held on for about 4 days, and then I was kind of able to scrub them off. So it was a little pink and swollen the next day. Sometimes the swelling is nice, it builds up your wrinkles, and everything looks good. But I encourage you, if you're interested in the treatment, you've never had one, we have a lovely video you can torture yourself by watching, but it goes through everything. Here are some tips just to kind of, if you're getting a fractional laser, Oh, no, we went backwards. Hang on. Like you said, like I mentioned, wear not your best clothing, or you can bring your best clothing. We can change into a gown. It's not your greatest hair day. We'll help you with some skincare products. The fractional laser, you're going to have more swelling and that texture change than just treating the brown spots or with the IPL. We have highly detailed information for any of the things that we suggest, and I encourage you to talk to our staff about what it's like to have these treatments done. So lastly, to help your skin respond the best that it can to these treatments, first of all, I recommend an anti-aging skincare plan. It's not the topic of today's discussion, but it does include vitamin C serum. Vitamin C is an antioxidant that helps prevent oxidative injury when you're in the sun. But it's also a necessary cofactor for collagen production. So we want that vitamin C on board. We're trying to produce collagen with any of these laser treatments that we're doing. So using a vitamin C serum concentrates vitamin C in your skin where we want it to be there and be active and help grow collagen. We can also pair your treatments with growth factors or serums. These contain growth factors, and some have growth factors and peptides that help with cellular renewal and help the production process. And you can use these year-round. They're very helpful creams, or you can just use them for the 6 to 9 months during and after your treatment. This is the FACTORFIVE Regenerative Serum. It contains growth factors and anti-inflammatory agent, as well as copper and hydrating agents. Excellent post laser serum. And we also have the Neocutis Bio Serum Firm. This one's nice because it has both growth factors as well as peptides to help you respond. And a peptide works as a protein, like an on button for certain processes in your skin. And we're trying to produce collagen or renew, and these peptides help stimulate that. They're great for everyday use, but this Alastin cream specifically helps your skin get rid of the old collagen, the old elastin, and bring in the new collagen. So it's a renewal cream. There's 2 of them. You start with a serum after, and then you transition to the restorative cream. I think this has actually really transformed some of the results we're getting from all of our rejuvenating treatments, and including filler. We use this after filler because we're trying to stimulate collagen with filler. There is also a product by Alastin that contains arnica that reduces bruising. So we will take some questions. If there's any, you can hit chat.
You can ignore the one about the scarring and stretch marks because you showed slides after I asked the question about that. So thank you.
Absolutely. So these same lasers that we use to rejuvenate the skin, the same concept is used for scars, acne scars, and other types of scars. But a stretch mark is essentially a scar, and there's loss of collagen and elastin. We may not use all the lasers together with that, but we can get some nice results in stretch marks, particularly early stretch marks. Let's see here. So here's a question. How much time would I need to wait from the time I use tretinoin to beginning the laser treatment? Honestly, depends on how sensitive you are. There is no contraindication right up before. However, after, you're gonna have to put your tretinoin and your retinol on hold until your skin has recovered. So before the treatment, I think you can stay on your skincare regimen as long as you're not too irritated. But after, and it depends very individually on when you can start, but you need to let your skin heal. So for me, after day 4, when much of that kind of the texture peeled off, it doesn't peel, it just comes off. We say peel, but you don't walk around with sheets of skin peeling off. And I kind of rubbed some of mine off with some moisturizer and a little abrasive agent, a little exfoliating agent. And then depending on how red and sensitive or fresh your skin is, you may not feel comfortable starting a retinol. And it also depends on your history with using a retinol. I probably started mine on day 5 after the treatment and was fine. But I kind of have tough skin, so I'm not everyone. And the same concept, we talked a little bit about stretch marks and scars. Same thing. If there's a red scar, we will use our red lasers to target that prior to an energy or a laser treatment. If there is brown in a scar, we'll use our pigment laser to renew that. Tonight's discussion was about laser because there's a lot to talk about with laser. We also have a lot of energy treatments we use to renew the skin. Every energy treatment we have is radio frequency. So we have radio frequency microneedling treatments and then microneedling alone for stimulating collagen. I also did not touch on some of the treatments that have no downtime, kind of maintenance treatments. And one of those is the what we refer to as the Hollywood facial, which is a Q-switch 1064. Kind of gets your party ready with better looking, fresher, more glow to your skin for a quick event, but it's really not going to renew sun damage or do pigment or anything like that. So it's just a nice, it's almost like a laser facial is kind of what we call it. And that's good for maintenance. If you're wondering what the maintenance is, you typically will do a series of these. And then I'm frequently asked, how long does it last? Well, it just doesn't disappear, except we talked about in the beginning, kind of the sands of time. You're losing collagen, and that's accelerated by sun exposure. And so I do recommend yearly signing up for some of these treatments that remove sun damage and or stimulate collagen. So we keep that collagen bank going. It's like making an investment in your collagen bank. Unfortunately, someone's making a withdrawal without your permission, and that's called age. So we want to keep kind of putting more deposits in that collagen bank. The other reason I recommend a good anti-aging skincare plan and trying to avoid the sun where you can, because that sun exposure will accelerate the withdrawals from your collagen bank and accelerate the aging process. So the new concept is kind of staying on top of everything and keeping things going. So your results from these just don't disappear, but more sun will stimulate brown spots and collagen loss. Regarding the brown spots, I often say brown spots have a memory. It's really uncanny. But after a lot of sun exposure in the summer, many of our patients experience a little recurrence of their brown spots and come in the fall. So this is a timely topic. It's time to get your treatments done and remove some of that sun damage. Yeah. Okay. Is Fraxel okay for rosacea? Yes. It is, although I will tell you, if you have rosacea, I might recommend our new energy device, Viva, because it helps with the redness. Okay. I don't know how to use this mouse. There we go. One question is, do I need to schedule a pre-consultation? It kind of depends. If you are not new to this, you've had this before, and you know the routine, we can book you for a treatment. If you're brand new to these treatments, I would suggest a consultation. We can possibly treat you the same day, particularly if you email in some photos for us or upload photos. But I think it's nice to sit down with someone, have your skin looked at, let us look at, is there brown, is there red, are there blood vessels? What is there crepey skin here? What are we targeting? And come up with the plan so you know what you're getting. At the same time, we don't wish to inconvenience anyone. We want you to be as informed as you can and to make sure that we're putting together a plan that's really best for you, that's meeting your goals, and putting everything together. And someone says, I've had Fraxel laser, but wasn't aware you can get it all in one visit. Yes, you can get it all in one visit. So just like I did, you can go get your brown spots treated. If you have veins on your cheek that need to be treated, we can go to that laser and treat the veins, then the topical numbing, and then the fractional laser treatment. And that combination of devices really yields phenomenal results. And I pioneered this years ago. It is very commonplace now, I think. I think the word is out. But it just started coming from trying to get the best results and as few treatments for people so as not to inconvenience them too much. Oops. And then someone saying they tried retinol and it irritated me. There are some newer retinol products that I think are phenomenal. My goal with a retinol product is to find one for you that you can use on a regular basis. So regular meaning like every other night or every third. In terms of anti-aging, retinol on the skin is converted to retinaldehyde and the active ingredient in the skin. So you don't have to use tretinoin to get that benefit. And you also don't have to have irritation. And in fact, I think sometimes irritation works against us. So sometimes people tell me I just want to use the strongest thing I can. But I don't really like that, because sometimes what happens is they just use it once a week and then they take a 5-day break and then they use it again. I'm looking for the product that meshes with your skin and you can use it on a regular basis. So we get that good uniform consistency for the benefit. The Avene, A-V-E-N-E, we have in our skin store, Retronol is real mild, and there's another one that's real mild. So we don't need to keep torturing your skin, but we can certainly try some things to help increase your tolerance of the retinol. Do we use lasers on body parts? Yep, we sure do. Neck, chest, arms, and even legs. As you move away from the face, the treatments have to be turned down in intensity, and so it takes longer to see your results. So more treatments and less results, but they do work to stimulate collagen and remove brown spots. We also have to kind of think about cosmetic areas, so we may kind of do this area. On arms, it's challenging. I may recommend just forearms and hands before we move on. Legs are challenging too. We treat a lot of brown spots on legs. It's hard to do a large area on the legs. One of the constraints we have is the topical numbing. We can only put so much topical numbing on your skin. We don't need topical numbing for the brown spot treatment. So we can kind of be creative and come up with something. I don't know how to get down to these things. I can't. Let me see. Aha. Okay, someone's asking who on our team administers the lasers. We have some nurses and estheticians that use the lasers. They're all highly trained. And sometimes I do as well. When we get into the ablative lasers that have downtime and higher risk, those are the ones I do. So the more aggressive lasers are the ones that I do. Are we down at the bottom? Few messages. That's it. All right, I'm going to scroll through the messages again. No, lasers can't make you smarter, unfortunately, which is what I need now, computer science. Well, I think I answered all the questions that are here. Again, I mean, we could carry on with this for hours, as you notice, and we left off talking about devices and like the Venus Viva, which is radio frequency, and I love that treatment, as well as Infinity Genius, which is microneedling radio frequency, and then good old-fashioned microneedling, and we can discuss that at another time. And let's see, let me, oops, I'm gonna type a response here to somebody, but thank you guys for your attention. I am obviously really passionate about this. I love it. It's so fun. And I think it's phenomenal helping people get better looking skin. And I'm reassured in the process because I know when I do that, I'm making it healthier too. These lasers are safe. They are predictable in the right hands and with the right judgment. And we take the time to make that judgment for you and to choose the lasers that are best for you so you get good outcomes. And it's just great, you know, when people come in for follow-up and we say to them, we're going to need you to take your makeup off. And they proudly tell us, I'm not wearing makeup. I mean, that's wow. I mean, that wow factor of better looking skin without makeup. And that's just what I love. I don't wear much makeup. Well, I misspoke. I don't wear any makeup because I'm terrible at putting it on. But thank you for your attention. And we would love to answer any more questions tomorrow, but I'll let you get on with your evening. And I hope everybody has a wonderful rest of your evening. Bye, everybody.